This segment is sponsored by Southeastern Orthopedic Institute. The claims and opinions made in this segment are not necessarily those of Live 5 WCSC.
Today, Dr. Mark Harrow is back with me from the Southeastern Orthopedic Institute. Dr. Harrow, thanks again for being here.
Great, thanks for having me.
What are some of the causes of shoulder pain in athletes and active individuals?
Yeah, I mean, I think it's easiest to break it into certain categories. And again, they tend to be traumatic injuries. So again, my shoulder was doing fine, but now I injured it, I fell, I broke it essentially. And so that's traumatic injuries. And then we see more of the overuse type injuries where people go to the gym and start gradually having an onset of shoulder pain. And then there's like a third category that kind of always creeps up in most parts of the body is arthritis, which can sometimes have a little bit of overlap with those first two categories.
When someone's experiencing a shoulder issue, at what point should they seek out medical care?
Yeah, I mean, I think with a significant loss of function, like all of a sudden I can't lift my arm overhead, I can't pick something up, I can't reach something out of the refrigerator, I think that's time to have it seen. If it's something that's been going on for a short period of time and you're going to the gym and it's hurting, it's a little bit sore, I think it's okay to take some anti-inflammatories and give it a little bit of time. But if there's a loss of function, I think it's better to get that checked out sooner rather than later.
As far as diagnostic tests are concerned, if someone has a shoulder issue, does that usually mean they're going to need an MRI?
Not necessarily. MRIs are expensive and they do give us valuable information, but I think a good physical exam and really talking to a patient, you can really find out many times what the problem is. And for a lot of us, we use MRIs as pretty much a surgical tool about what to fix if we need to fix anything.
So if a patient does get an MRI and you do see a tear, does that automatically mean they need surgery?
Not necessarily. Depending on what the tear is, where it is, and the patient's examination, a lot of times we can treat these without surgery. But again, an MRI can sometimes give us some of that information on whether something needs to be done about it sooner rather than later.
As always, very interesting stuff.
Right. Great. Thanks for having me.
Dr. Harrow, thanks for being here.
Yeah, thank you.
For more information, please visit southeasternorthopedic.com.